My name is Russ Cohen. I'm an orthopedic surgeon in Tucson, Arizona. I work at Tucson Orthopedic Institute, where I've been in practice for 20 years. And my subspecialty is joint replacement, subspecializing in hip and knee replacement. I was born in Johannesburg, South Africa, and my family immigrated to the United States in 1979. My father was a OBGYN, and I was a fifth-generation South African, so it was difficult to leave. But we all moved to Phoenix, and I grew up in Phoenix during the high school years, and then came to Tucson, where I went to undergrad at the University of Arizona. And then I stayed there for medical school, also did my residency at the University of Arizona. Then I went to Chicago and did a fellowship in joint replacements at Rush Presbyterian St. Luke's. My desire to go into orthopedic surgery started at a very young age. I was pretty active growing up in South Africa. We led a very outdoor way of life, lots of sports and things to do that got us in trouble, breaking bones. I ended up having back surgery actually a month before we emigrated. And around the age of 12, I knew that I wanted to go into orthopedic surgery. So I didn't only know I wanted to do medicine, I knew that orthopedics was my calling. It just was a great way to help people, restore function, get them back to enjoying life. I'm not sure I really went into medicine to save lives, but I do enjoy making people feel better and to enjoy the time they have here on earth. My philosophy about patient care is that every single patient deserves your very best. Every patient is treated equally and fairly. Nobody's stratified according to anything other than their problems. And I've really done my very best over the course of the 20 years to treat everybody as if they were a family member or the most important person during that time, whether it be in the office or in the operating room. So many people, when they retire, are looking forward to doing all these fun things and then are stricken with a bad hip or a bad knee. And being able to restore their function and to do the things they've waited their life to do is something I've really enjoyed. And during residency, had a good mentor, and then during fellowship really was able to fine-tune my skills and realize that was the calling for me. Joint replacements have evolved so much in 20 years. At Rush, where I trained, it was relatively standard type procedure back then, but about 6 or 7 years into practice, we then started to do less invasive surgery or minimally invasive surgery, which I jumped on quite early on and became somebody that trained people and jumped in feet first. Enjoyed that, got fairly adept at doing things through a smaller incision, more muscle preserving surgery. And a couple of years ago, when Mako started to offer platforms for total hip, total knee, as well as the partial knees, it now was something that I could incorporate to every patient. It's obviously a learning curve, but I think the accuracy of the surgery, the ability to fine-tune placement of implants for any given patient, and to be able to do things in a much more precise way has just been fantastic. So I'm a big believer and really enjoy doing Mako. I think it's the future. So my family includes my wife, who has been at my side for almost 30 years of marriage. And we have 3 wonderful kids that all grew up in Tucson. We love Tucson. We've lived here for a long time. It's a very easy, nice way of life. It's beautiful. We've become very outdoorsy as far as hiking. My wife and I enjoy hiking on the weekends when it's not too hot. And we've got some beautiful trails that are within a mile or 2 of our house. So we spend a lot of time outdoors hiking and exercising. One of my other pastimes is photography. Really enjoy taking photographs and starting to use that as my outlet, getting behind the lens and seeing some of the beauty that's surrounding us. So on a recent trip, we went to northern Arizona, went to Antelope Canyon, and went through the Slot Canyon with a friend of mine who's a photographer, and learned some things and some techniques. But beautiful part of the country up there, seeing the colors and the different lines in the rocks. And then one of my favorites is a picture of the rock formation that looks like a Native American. It's got a nice beam of light coming through, and it's fun because you get to frame them and enlarge them, put them in your house, and bring back memories every day you walk by it. So photography is just a blast. One of the things I'm most proud of and enjoy doing actually now the most is volunteer work. We started back in 2010 when the earthquake hit Haiti, and myself and 2 of my partners, Dr. Anktil and Dr. Good, and one of the anesthesiologists from our group, got on an airplane with a bunch of people we didn't know and went down and did some volunteering to just do some basically MASH type work, helping people wherever we could help them, and sort of caught the bug from that. And since then, every year now, I've done a Operation Walk, which is a group that was based in Los Angeles, and have volunteered with them and Hanoi, Vietnam twice, and Antigua, Guatemala this summer. And then Tucson Orthopedic also has a program through Dr. Piedrahita, who is from Ecuador, and he has sponsored a trip down to Ecuador every year to do knee replacements. So as soon as the trip is over, I can't wait to get invited to the next one, because it's just something that's really a lot of fun, and I think brings it all to a great meaning.